everyone. So in this podcast, I've talked a lot about the benefits of therapy, but I haven't covered how to find that therapy in the first place, which can definitely be a challenge. To explore this question, I've invited Andrea Muraskin to speak with us today. Andrea is a contributor to NPR's health blog and writes the weekly NPR Health newsletter. She's also experienced anxiety, depression, chronic pain, and lots of therapy. In the past, I've invited lots of therapists and other professionals in the fields of mental health to speak with us, but for this episode, I really wanted to talk to someone who had knowledge about finding a therapist and also had the experience of being a patient. Andrea, do you have anything to add before I jump into my first question for you?
No, you can go right ahead.
Okay, great. So the first thing I wanted to ask is what inspired you to write this guide on finding a therapist?
So, as you said in the intro, I'm a contributor to NPR. If people don't know, NPR is National Public Radio, but they also have a website and socials and podcasts and all of the things. And one of the podcasts is called Life Kit, and they do kind of all different kinds of like adulting advice. And it's a great show. And they had an episode last year about how to end therapy or how to kind of break up with your therapist. And we put that in the newsletter. And then we got an email, and this reader said, well, I think that article on how to break up with your therapist is elitist. I mean, only an elite person can even afford a therapy, let alone end therapy. And I thought, I see where this person's coming from. Therapy can be expensive. It's not as accessible as your medical care, like your primary care, your OBGYN. And so I wanted to write a guide to finding a therapist that included both your mental health needs and your financial concerns.
Yeah, that makes sense. Perhaps part of the reason it's not as accessible as, for example, primary care appointments is because a lot of people see therapy as a luxury rather than a necessity. And that's why a lot of people who are socioeconomically disadvantaged might not get therapy. And I wonder how many fewer suicides there would be, how many fewer people there would be in jail if everybody had access to therapy, not just the wealthier people in society.
Well, I think there's a few things. I think there's a stigma around therapy, which I give a lot of credit to Gen Z for breaking that down and talking openly about mental health. So it's getting better, but it's still there. And then when you look at health insurance, some of them may not have any benefits for mental health. It's not, or, with the Affordable Care Act, you have to provide preventive care, like that annual primary care visit, but mental health is not considered preventive care. And even when you do have mental health, it's often a smaller network than your medical network. Vision, dental, mental health are all like segmented off from your general health care as if they're not essential. And it's just kind of the unfortunate state of the way things are in this country.
So for people who are struggling to find affordable therapy, what advice would you give them?
Well, first I would say if you have health insurance, to go on your network providers page and see what's available to you. One thing that's helpful that came out of COVID is the proliferation of telehealth. Health insurance is often regulated by state. You just have access to the people in your state or maybe a neighboring state, depending on where you live. But now with telehealth, a provider can be living in Arizona and licensed in Arizona and Massachusetts or Florida, depending on where they've taken the licensing exam. So that gives you access to people outside of, especially, if you live in a crowded urban area, for example. I live in Eastern Massachusetts. So when I was looking for a therapist, I saw there were more therapists available in Western Massachusetts where the population isn't as high. You may have been a rural area with not a lot of just healthcare providers, period. If you live in a rural area, you may not have very many providers in your immediate area, but you might have access to providers via telehealth in an urban area. Another option is community health, which is often free or low cost, available to people on Medicaid or with no insurance at all. And there's something called federally qualified health centers. They get funding from the federal government. There's a link to where you can search your area for those, which I included in the article. And something that I didn't include in the article and I found out later is that Sometimes if you live in the vicinity or even the same state as a university where there are students in social work school or getting another therapy qualification, they need practice hours to get their certification. So you might be able to work with a student therapist for free or for a lower cost. There are also some therapists in private practice that offer sliding scale based on your income or your parents' income. I've seen that as well. And sometimes they have a certain amount of sliding scale patients that they can take. So it may be worth asking as well.
That's really cool. I knew about telehealth and community health, but I had no idea as a university student that there were kids who needed to get certain hours of therapy given, so you could just get it from them, which would be like a win-win situation. So that's really good to know. And how did you gather all of this information that you've written about and that you're talking about today?
Well, so for the article, I interviewed two therapists. One of them is Teresa Yen at the group called Mental Health America. So it's a nonprofit that has low-cost community mental health in several different cities. She's a social worker. And then I also interviewed Lynn Bufka, who is a psychologist and represents the American Psychologists Association. And, there was a little bit of Googling and information that I've accumulated through years of going to therapy and having different insurance plans and some previous reporting that NPR did as well.
Well, thank you so much for gathering all this information and making it concise for us, because now you can communicate it to me, I can communicate it to the listeners.
I was thinking about, for a student, it might be something like doing a research paper where it's very unlikely that you're going to go to one website and click and find your perfect therapist that fits all of your needs and your budget. You're probably going to have to look at multiple sources and do kind of a search.
And that can be so hard with therapy, because a lot of times I think it feels like, oh, I finally got a therapist, I need to stick with them, because it might be months before I find someone else, even if you're not really clicking with the therapist you have.
Yeah, that's a great point. One of the questions that I asked Teresa Yen was how long would you give it? It's also a little bit like dating. You want to be able to feel the person out. The vibe really matters. Should be somebody that you feel like you can trust, who's not going to judge you and you can be open with. And so she said about 3 to 5 sessions is what you would give it. I've also had therapists that's okay, this is helping me some, maybe I want someone else in the long term, but I really need therapy now. I also had a therapist that I felt worse after the appointments. And I'm well, why, this is not doing me any good. This is doing more harm than good. So I'm going to stop seeing this person and look for a new person.
Yeah, I know in the article you said that finding a therapist is kind of like apartment hunting. And I was thinking a lot about that analogy, because it's almost like if you're really desperate for housing, you gotta stay somewhere, even if it's not your dream house. But if you're living in a house that has black mold in it, sometimes it can be better than no housing. And sometimes you gotta stay someplace that's not great until you can move into your dream house.
Yeah, the way that I was thinking about that, and I live in Boston, it's a really competitive housing market, was that if you picture your ideal apartment, let's say my ideal apartment, have a dishwasher, have an elevator, it would have a nice big tub, it would have access to transit, I'd have outdoor space. So my apartment now, I just moved a month ago, I have some of those things. I have a tub, I have access to transit, I don't have outdoor space, I don't have a dishwasher. It's hard to check every single box. You might be picturing your therapist as a certain gender or ethnicity, or a particular age, or a short walk from your house. It really helps, especially if there's a lot of demand for therapy these days. It just helps to be a bit flexible in what you're envisioning. It helps to be a little bit more open, and I think it's really a relationship that is unfortunately something you can't totally tell until you meet or have a couple of appointments. Some websites like Psychology Today have little videos, so you could get a bit of a sense. Some therapists might have a website. Some therapists are on Instagram. So you might be able to get a little bit of a vibe. There is a certain amount of just trying. And I also wanted to say that if you don't know, you had a great episode, your last episode, on kinds of therapy. If you don't know exactly what kind of therapy you need, that's okay. A therapist can help you figure that out.
And I think it's okay to be with one therapist and simultaneously be looking for other therapists. I remember I did that with my first therapist, and then when I got a second therapist, I had to have this really awkward conversation where I was like, I've been seeing another therapist, I like her better, I'm gonna switch to her. It almost felt like you're dating someone and you're telling them that you've been seeing someone else at the same time. But she was totally fine with it. She was like, yeah, that's great. I'm happy you found another therapist. I mean, most people, they're professionals. They're going to be happy if you found help, and they're not going to get upset. So you don't need to be scared or feel like you're doing something immoral if you're hopping around therapists.
Yeah, and you can, read that article, How to Break Up with Your Therapist, or listen to that podcast episode if you want some tips.
Other than financial obstacles, are there any other common obstacles you think people face when they're looking for therapy?
Just availability. Therapists can be booked up. They might have a waiting list. I think it's gotten better in the past few years. During 2020, 2021, it was really hard. There was a big surge in demand during COVID. It was probably 2022. I was on Mass Health, which is Medicaid here at the time. I had people not even call me back. That was really hard. Sometimes I had access to great doctors, but therapists, it was so hard to find someone. I ended up paying out of pocket in that instance. But yeah, just that, the need to persist. And that can be so hard when you are having mental health struggles. And that's where one of the women I interviewed suggested asking for help from a parent or another trusted adult, especially when you're in school, to make phone calls. That's totally okay. It shouldn't be so hard to get help. So it's totally reasonable to ask for someone to kind of help managing the logistics of it all. I was also thinking that, so I wrote this article for an adult audience. If you're in a situation where you're a teen and you don't want your parents to know that you're in therapy, obviously that could be a challenge. And I don't know a lot about that. I mean, if you're on their insurance, they can find out that way. There are community mental health services that don't go through insurance, so you might be able to access one of those. There may be resources specifically for teens that I'm not aware of. Like I said, I wrote this mainly for adults. Some people have bad experiences with therapy, and, therapists can be very variable. Like even someone with the highest qualification could not be a good therapist or could not be a good therapist for you. So sometimes people will have a negative experience and then they won't want to try again.
One of my friends, she had this therapist who told her, like, oh, the root of all your issues is your selfishness. And she is one of the most selfless girls I know. Like, she's the type of person who would, come to my house in the middle of the night if I needed something. So I was pretty upset when I heard her therapist say that. But she did keep trying to find other therapists, and she found someone who's much better. So I would encourage anyone listening to give it multiple shots. Even if you have one bad experience, just like people in any profession, therapists are very variable. There's ones that are going to be great for you and ones that are going to cause more damage than good.
Yeah, I would agree with that.
Yeah.
100%.
How can someone effectively determine their mental health needs before seeking therapy?
Well, this is something that I would defer to your previous guest, who is a therapist. You don't necessarily need to know. If you have a diagnosis like ADHD, if you've had a traumatic experience, if you've experienced abuse and you have PTSD-like symptoms, you could go on Psychology Today or on the Mayo Clinic medical websites and look up what kinds of therapy might be best for you. For example, EMDR is pretty popular and successful with people with PTSD. That's an eye movement-based therapy. And I would say but if you don't have a diagnosis or if you think you may have been misdiagnosed, I would just pay attention to your feelings. I think something that's helpful that Teresa Yen told me was think about what you want to get out of your experience of therapy. Even if it's not your choice to go to therapy, because I know that can be the case if you're a minor, how would you like to use the time? What would you like to come away with? What would you like to work on? When you search directories, you can search by type of therapy, multiple types at the same time, something like Therapy Den or psychologytoday.com. Yeah, I think that answers your question.
Yeah, it does. I think that also ties into the idea of you might need multiple therapists because my first therapist is the one who diagnosed me with OCD, but she wasn't an OCD specialist. So we kind of reached this point where we were just talking about my symptoms and my problems, but we weren't doing anything about it. So then I started looking at OCD specialists and then I switched and that was way better. It might take one therapist to even decide what you want to work on and then another therapist to implement those changes.
Yeah, when it's your first time and you may get I think that's a great example because you didn't know that you necessarily had OCD and you needed that diagnosis. Most therapists are generally trained in a variety of disorders. So it is sort of comparable to going to see your general practitioner, your doctor. They can diagnose you, they can help you with a variety of things, but then there's a level at which they're going to send you to a specialist. And, often when we're young and it's our first time in therapy, we don't know ourselves that well yet, and that's okay.
Exactly. And you're also going to keep changing. What you wanted to work on a year ago isn't going to be the same thing as what you want to work on right now.
Yeah, and the modality, the way you get there may be different. Or, you may be in a worse place. You may be, I have depression, and at one point in my life, it got really serious. I went to the hospital at some points when I felt that I wanted to take my own life. And then I went into DBT, which is for serious depression and disorders. And that was wonderful. It gave me all these amazing tools. I was in a group setting. It was very intensive. I had my workbook. And now, I do something completely different because I have different needs.
Well, I'm so glad that the DBT worked for you. And I'm so glad you went and got the help because I think a lot of times when people get super depressed, they're like, I don't even want to do anything about it. But I'm so glad that you went to the hospital, you got the DBT, and I'm going to assume you're doing better now. You don't regret that.
Yeah, I'm doing much better. And it wasn't only the DBT. I had other meds and other medical interventions that really kind of got me out of that really deep pit. But just to see, because it is a sort of a curriculum with DBT, and I was in it long enough that we started over, to see the changes in my answers from the first time to the second time, I could really see my progress. So that was really
great.
Amazing.
Yeah, that sounds amazing. I know another challenge people can have with therapy is obviously, I'm assuming most of the audience is from the US. We're a big melting pot of different cultures. And sometimes you might end up with a therapist whose advice kind of contradicts your cultural beliefs in a way. So how would you navigate that?
That's a good question. So there are a limited number of therapists who specialize in particular cultures. There was an article that I linked to here that I thought was really good. The therapist was Cambodian American and dealing with immigrants and the children of immigrants, children of refugees. So either they or their parents had been through very serious student trauma and war, and to be able to relate to that. Another thing Teresa and Ann said to me is it can be hard to get that person. It's something that could come up in the interview. You can interview your therapist. You might have a 15-minute free consult or even your first appointment and say, have you worked with people of my ethnic group? Or have you worked with people in my economic situation or with my gender identity? That's perfectly valid for you to ask. And you could even ask if they have any kind of specific training in that area.
Yeah, that's a really good point. I think most people don't interview their therapist. They kind of go in not knowing what to expect, which is okay. But if you have specific concerns, I think it's good to voice them out early, especially because you're going to be putting a lot of time and money into this. And for most things, if we're investing time and money into them, we like to do some research beforehand. And I think it's kind of the same with therapy. Just like any job or any relationship, if you have questions, it's good to ask them.
And I think if your therapist gets really defensive or says like, I shouldn't have to answer that, that's a red flag to me.
If your therapist gets mad at you, that's a glaring red flag.
Or it's just like, kind of gives a kind of a BS answer to your questions. Mm-hmm. That would be a red flag too.
Yeah, I agree with that. And this kind of ties into my next question about, do you think it's important for therapists to disclose who they are as individuals?
So the two therapists that I interviewed had different feelings on this. Teresa Yen, who's a social worker, said for her, she feels comfortable when the therapist talks a little bit about themselves because, after all, as the patient, you're sharing a lot about yourself. So this idea of reciprocity. Lynn Bufka said, the more traditional training, especially for psychologists, was that the therapist was something of a blank slate, and it's really about the patient. And so not every therapist, depending on their style, maybe when they were trained, will be comfortable disclosing. And that doesn't mean that they're not a good therapist. And I think there's a lot of in between. Like my therapist now, I don't know a ton about her, but I know that she loves cats. And after a while, I was like, let me guess how many cats you have. I'm like, it's definitely at least two. I know that she's a lesbian. I know that she's married. Some of these things I've just sort of learned over time. It's not that she's telling me the story of her life, but it's just kind of like little details that give you a sense of someone's personality, like where they're coming from. I wouldn't want to have a therapist who just kind of really boxed off their personal life, but I also don't need to know like their own mental health history, for example.
Yeah, I guess it depends what each person wants. And I'm guessing no one wants the extremes. Like no one wants to go into therapy and the therapist is talking the entire time. You got two words in. Or like someone who's very cold and closed off. Most people would want at least a little bit of friendliness or openness. But, I mean, is that something you could ask during the interview? Like, in your style of therapy, how much back and forth is there going to be between us? Or are we really only going to be talking about me?
Well, absolutely. And that's a great question. And not all therapy it's not always the conversational model too. Like in IFS therapy, which is what I do now. I mean, sometimes we talk, but when we do sort of the core IFS work, stands for internal family systems, it's more of like we are talking, but it's sort of like my therapist is guiding me through an internal experience, and I'm trying to communicate with different parts of myself. And she might prompt me, like, ask this part, because we talk about different parts representing different feelings. Like maybe my anxiety is like a little hamster on a wheel. Well, ask the hamster, how old does it think you are? Ask it what it would be doing if it didn't have to run on the wheel. And so it's not like the standard regular conversation. If you're doing EMDR, your therapist is going to be moving their finger or these lights back and forth in front of your eyes, and you're going to be recounting a trauma. And so it's not like a question answer. So that, if you're doing something more mindfulness based, they might do a guided meditation. And not everybody likes to just chat. Some people need that. Some people would rather do something different and are maybe introverted or already talk all day, and that's not the therapy they need. So I think that's a good question to ask, sure.
That's really interesting. I've actually never heard about either of the forms of therapy you just talked about. So it's good to know that there's therapy beyond your traditional conversation model.
And I mean, I think that's one of those things that, I mean, DBT also, it's like, well, if you work with an individual therapist, there's a group component and individual component, but the group component is like you're doing an assignment, you're reading together, you're sharing. That's another thing where different things can be good at different times. You know, I remember my mom had been at therapy many years and she was like, I just ran out of things to talk about. And I'm like, I feel like you still have some issues, Mom. You know, there's just different ways of getting at them that I think can be super helpful. You know, and some therapists do more than one thing. I do like when the therapist has some flexibility. Like sometimes I just need to tell you what happened and then we can process it. If the therapist is very rigid and is like, we have to do everything in this order. I saw one therapist who like, some therapists can get so specialized and specific. She was like, I work with intergenerational trauma and my intake is 10 sessions long. And then she ended up dropping me because I wasn't like, I feel like I had to be more regulated and stable just to work with her. So, you know, especially when you're young, like it's good to have someone who's like, okay, we can do this and this, but we can also just talk if you need to talk, you know, someone who's flexible and relaxed, I think.
Yeah, I agree. I think for most people, it's good to have a therapist who has a baseline or an outline of how the therapy should go, but they're not afraid to deviate from it.
Yeah, and they might have an outlook like, you know, seen different therapists with different qualifications, and it's not something that I've necessarily experienced that a social worker is super different from a psychologist. But one thing that Teresa Young said, who's a social worker, is like, if you have problems with housing insecurity or abuse, you know, problems within the social system, accessing resources, that's something that social workers are trained to help with. They may have a more like systems-based approach, you know, understanding environment, whereas like a traditional psychoanalyst will be more focused on the individual and like family dynamics.
I volunteer at this domestic violence agency, and we have free group and individual counseling for people experiencing domestic violence. That kind of also reminded me of the community-based health that you were talking about. I think it's good sometimes that a lot of these organizations can be specific because we don't see people who are not domestic violence victims, which can suck if you need therapy. But for people who are experiencing that, you get to go to someone where they're going to be understanding of that background. Whereas a traditional therapist might be like, you need to leave your partner, they're terrible. But someone who's experienced in working with DV patients, they'll understand that it's not that simple. And giving like a very black and white solution like that isn't helpful.
That's a great point. And, you know, you're saying that like, everyone does have their blind spots. Therapists are human, and if you are in a very sensitive situation, like I would trust your gut that you need specialized care.
And what other advice do you have for someone who's just feeling overwhelmed by the process of finding a therapist?
I think psychologytoday.com is helpful, and also Therapy Den. You can search by your insurance and like different modes. And I do like watching little videos and seeing like what they've written about themselves. You can search by insurance. You want to check it with your actual insurance company too, because sometimes there can be a discrepancy. I think, you know, getting to look at the profile, the faces, and getting to read a little blurb that they wrote, like it just feels like it's more of a human part of the experience. And you know, I'd like make a spreadsheet. It sounds dorky, but just to track it and to see like who you've contacted and, you know, whether they've gotten back to you. You might need to follow up. And, you know, I would also say like there are the apps that could be easier to access. Talkspace Takes Therapy, BetterHelp, I'm sure you've heard on every podcast. It can be, what I've heard is that there's more turnover in apps compared to other types of therapy. But also, I would say if you get overwhelmed, use an app like Insight Timer or one of the mindfulness apps. There are free versions of these apps. There are resources that you can use to self-regulate even before you find that therapist.
I know Headspace is one of them. That's one I've done. I know a lot of insurance companies also have their own website or a program that they're affiliated with, like Aetna's My Insurance, and I can't remember what it's called, but there's a website with just therapists that I know are covered with my insurance, and they have a little paragraph about what they specialize in and a photo of them. So you can check if your insurance does have a website like that, that would save you the hassle of trying to navigate the insurance policy.
With my insurance, I found that there's more information about the individuals off of the insurance site, but it could vary by your insurance. And even the other thing is you can ask for referrals. My first therapist I found through a friend, and he was terrific. That could be something of a shortcut.
Yeah, that's a great idea as well. That's all the questions I had today. If any of our listeners have questions, please don't hesitate to email notanotherdepressedteen@gmail.com. You can also DM Andrea with questions as well. Her Instagram is Andrea Muraskin, and I'll put that in the episode description. I'm also going to link her original article on how to find a therapist, and I would encourage anyone who's curious to take a look at that. Thank you so much for your time and advice, Andrea, and thank you for those of you listening for supporting Not Another Depressed Teen. I hope this episode was informational, and I hope everyone listening has a great day.